And we're here
This meeting is being recorded.
We're here co-hosting the Aurora and Scottsdale Youth and Community Coalition. I'm really happy to be part of the conversation this morning. So just a little bit about the Scottsdale Youth and Community Coalition. We're an alliance of community professionals that provide resources to support youth and families in the Scottsdale area and really far beyond. Our goal is to engage and educate and empower others to navigate solutions, specifically in the areas of mental health, substance use, and eating disorders. We have a website of resources. We have a monthly virtual professionals meeting, and then we have biannual in-person events, and then we get to, throughout the year, co-host with Aurora, which is really fun to do these free CEU events. I will put that information in the chat, but now I would like to introduce our wonderful presenters. We have Dr. Stacy Krause. She joined the Transitions Counseling and Consulting family as the owner and CEO after 10 years of active duty service as a psychologist in the U.S. Army. She is the recipient of a Bronze Star Medal, a Combat Action Badge, and multiple meritorious service medals. She is also a double diplomat of the American Board of Professional Psychology with certifications in both clinical and organizational psychology. Amazing woman. Dr. Krause, her professional experience has included executive level management roles, leading diverse behavioral health teams, as well as designing and directing an APA accredited doctoral internship program. Dr. Krause also holds an MBA from the University of North Carolina at Chapel Hill. We also have Jessica Brubaker. She is the Director of Training at Transitions Counseling and Consulting and one of its founding members. She is a graduate from Grand Canyon University, where she progressed to her current faculty position in the undergraduate department. Jessica's specialties include mental health care with adolescents and self-care for helping professionals. Due to her experience, Jessica is frequently invited to speak at both regional and national conferences and has given a popular TED Talk on self-care. When she is not working in a clinical capacity, Jessica is passionate about spreading the word about self-care through her blog and podcast, Brutiful Journey. You two are amazing women. I'm going to just...
It was how you read that. I was like, oh my gosh, I sound so cool.
Well, you are. We're going to have a great time learning from you today, too. So Jessica and Stacy lead the team at Transitions Counseling and Consulting. Their team provides therapy, medication management, intensive outpatient programs, and partial hospitalization programs with a specialty focusing and working with teens and emerging adults in Arizona. They also have the privilege of leading a robust practicum and internship training program for future clinicians from across the helping disciplines. Transitions just opened their newest location in Goodyear, Arizona. They have many locations all throughout the valley. I'm going to pass it over to you, two amazing women. And just as a reminder to our participants, we'll be looking in the Q&A for questions. We will try and answer them as we go, or we'll have 15 minutes at the end to answer those questions. All right, I'm passing it over.
All right, thank you. And while all of those things sound so amazing, Jessica and I are we're just people and therapists, like all therapists in the world, who are always learning and trying to do better and more with a really tough job. And I'm sure everybody on this call can really empathize with that no matter how long you work in this field, there's always new things to learn. And one thing we're going to try to do now is take over the slides, and there might be a little bit of a technical delay.
I think that's one thing that the pandemic got us really good at tolerating, the technical difficulties.
Yes. Okay. Jessica, are you able to see the full screen?
I am able to see the full PowerPoint, not as if it's in presenting mode.
Okay. Oh, you know what? I have another idea.
While you're setting that up, Stacy, I'm going to jump in and let everyone know that we will have the slides available for everyone at the end of the presentation that will be sent out when the CEUs are sent out. I know that's a common question that just came up.
Okay. Okay, how about if it looked like this in the PDF view?
Beautiful.
Okay, open to your feedback too, audience. Okay, so Jessica and I, we spent a lot of time thinking about taking care of teenagers and emerging adults, and really people who are kind of on the cusp of going from one to the other. It's a big focus of what we do every day at work, and we spend a lot of time thinking about teaching future clinicians how to take care of this very special group of people. And we love working with this group of people, and I realize that not everybody does, because it does come with some unique challenges, unique rewards and unique challenges, I think. So today we're going to focus on DBT-based interventions, and we're going to try to get to as many of them as we possibly can. We also are going to focus a lot on talking about the things you can help an emerging adult practice in between sessions. So the primary work would be done by the person on their own time, because it can be pretty tough for a young adult to get into therapy with the same consistency as maybe you can in other periods in your life. So we want to focus a lot on that time in between sessions. Okay, here's us. You've already met us. This is us on when we were having a great hair day.
Yes, after a blowout, of course.
And just a quick look at our learning objectives for the next hour. So we're going to just briefly touch on some of the sources of scholarly support for using DBT with this population of clients. We're going to spend just a couple of minutes giving an orienting overview to DBT as a model. And then we're going to talk a little bit about a way to help a client understand, enhance their understanding of mental health symptoms, and present a number of interventions to help do that. And then finally, we're going to leave you with some resources to keep learning. Okay, so feel free to type in the chat. What comes to your mind when you think about or hear DBT? Okay, we've got some mindfulness, borderline clients. That one comes up often.
Yes.
Cognitive change. I saw a wise mind go by really quickly.
Yeah. Stress tolerance. Borderline personality disorder. I think that's the most common answer that comes up with this question.
Great. Oh, somebody just wrote 2 opposing thoughts at the same time.
Ooh.
Okay. And a quick question about CEs mixed in there. Okay, awesome. Thank you so much. Opposite action too. That's from Gabriella. Very nice DBT reference. And I have to say that for me personally, for a long time, I never really thought about what does the words dialectical behavioral therapy mean. It just seemed like it was sort of this title that went with the modality, but I never really thought deeply about what is trying to be communicated in the name of this approach. And really, at its core, DBT focuses on the existence and synthesis of opposites. So the tension between things like acceptance of how things are and change is really one of the foundational opposites in this way that comes up in DBT. But I also think that it's a little bit easier to think about dialectical scenarios when you think about it in the context of somebody's real life. So these are just a couple of examples that may come up for somebody who's in the stage of life of being an emerging adult, so between 18 and 26 roughly. So I'm enjoying my college courses and I'm overwhelmed by the work. I want to be independent and I want others to help me. This one comes up a lot, I think. And I'm happy to be away at school and I miss home. So this is kind of a nice example about the existence of opposites and the tension that exists between them. All right, so let's touch base briefly with the evidence base for DBT with emerging adults or college age clients. And I'll just spend a minute or two here. I will say that there are just, there's a plethora of really great scholarly articles that have come out in the past 5 years or so on this topic. And if we had a whole nother hour, I would just review them all because there's actually some really great reads focusing specifically on this group of people. So first up is this great article from 2012 by Pistorello and colleagues. This is probably the first really gold standard RCT, randomized control trial, using DBT with college age clients. And this was done in the College Counseling Center specifically. And they included any number of diagnostic presentations in this sample. So substance use, depression, anxiety, eating disorders, and borderline personality disorder. There was also a pretty high number of clients in this group that reported non-suicidal self-directed injury or suicidal ideation. And at the end of this treatment protocol, there was a reduction in frequency of the majority of symptoms and particularly good effect for suicidal ideation and non-suicidal self-injury in particular. And the really fascinating part about this one is that this was equally as effective as an alternate treatment that was presented, but really what differentiated it was that at 12 and 18-month follow-up, the people who did the DBT-based treatment had maintained the treatment gains. So they had a robust long-term response to DBT in particular, as compared to the other alternate treatment form that that the other control group participated in. So that's actually really nice to think about that sustained improvement over time, especially for things that are such safety concerns. Okay, next up, there was a pilot that decided that they did not have 9 months to run a DBT group with their clients. In fact, they had 8 weeks. And it just needed to be more practical based on what they could actually offer with their resources. And they actually found large effect sizes, so significant improvement in their active treatment groups, particularly for dysregulation, depression, and improved social functioning. There was also really low levels of dropout, which I think is phenomenal because that is such a challenge in delivering effective mental health care is people attriting from the treatment experience. And there was lots of positive feedback about people, their experience of how approachable they found the skills and also that they were applicable in their real life. And then lastly, for this purpose, our last study was focused on pretty diverse clinical needs. So in this study, they said any taker can come to this group. So anybody who is in need of coping skill development was invited to join a group-based DBT. And this was not adherent to DBT in the way that like Marshall Linehan would define it. It was more DBT informed. So the skills were focusing on DBT concepts. And they found that even absent borderline pathology or other more traditional applications of DBT, that people in general experienced improvement across symptoms like depression, anxiety, and general distress from participating in this type of interaction around DBT. They also saw improvement in all 4 target areas of DBT that you might focus on in treatment, which would be impulsivity, emotional dysregulation, interpersonal chaos, and confusion about the self. And what I think is so nice about all of these studies is that they balance the idea that quality of life is not simply the absence of pathology, it's also the presence of positive experiences, opportunities, social relationships, and skills. So they noticed across all of these that people did have reduction in traditional symptoms, and they also reported improvements in their relationships, in their life satisfaction, and other related types of metrics. So not just the absence of pathology, the presence of improvement too. All right. Jessica, would you walk us through the goals of DBT?
I will, and I'm going to make a quick comment on that last, what you were just saying. I think that the absence of symptoms and then also the presence of the positive things, that's it speaks to me to like the function of DBT, because it's both. That's the and it's this modality is something where people can really feel better and get better because they are reducing symptoms and increasing those positive things. That just popped into my head. I felt compelled to say it. So sometimes that is how I roll. Okay, I'm gonna actually take 1 second and move my, there we go. So the reason why borderline personality disorder is an example often when we ask the question, what do you think of when you think of DBT, is because the goals of DBT really kind of align with some of the pathology that individuals who are experiencing borderline personality disorder are presenting with, but also it really aligns with lots of different things, because suicidality and self-harm and depression, anxiety, those exist in other kinds of scenarios. And so generally the goals of DBT are to enhance somebody's capacity and capability by increasing their skillful behavior. The thing that I think is so interesting to notice with this modality is that these behaviors that we're seeing, they're still coping skills. Self-harm is a quote unquote coping skill. It's just not skillful in the way that we want it to be because it's not adaptive. And so the focus of DBT is to be able to harness the individual's capability so that they can increase the skillful behavior to cope with their distress, as opposed to those maladaptive skills instead. In addition, it's working to improve and maintain motivation to change and engagement with treatment. And that goes along with that feel better and get better, because I don't know if this is your experience with the folks that you work with, everybody on the call, but I think that motivation can really wane if they're not seeing results pretty quickly, or they don't have some relief pretty quickly. And so because DBT is such a tangible modality, it really allows people to see some improvement pretty quickly. Perhaps not like all of a sudden, oh, my suicidal thoughts are completely gone, but they can see that glimmer of hope, and it allows them to maintain motivation. We're working to ensure that generalization of change occurs throughout the entire treatment experience. We're working to enhance the motivation of the therapist. And I love that we underlined that, because I also, like Stacy said before, we're just normal therapists working every day. And it's hard to feel motivated when the person that is showing up on the other side of the couch, as I say, isn't feeling better or getting better. It's hard to have that motivation for yourself. And it's also really hard to know. One of the things that I do as the director of training is I work a lot with the interns, and I swear their number one question is, but what do I do? What do I do? What do I say? I mean, certainly in case conceptualization, we're talking about how to approach these things, but okay, so what's the first thing you say when they walk in the office? So having these tangible skills and these tools and the language that goes along with them really increases the motivation of the therapist. And then finally, we are looking to assist the person in changing or restructuring how his or her environment looks, so that the supports will allow the progress to maintain across the continuum and they continue to advance towards their goals. So I'm going to talk a little bit about the modalities, but overall DBT is looking to help them feel better and then also maintain that level of feeling better.
I just have one quick addition on this list. And when I saw this presented this way for what the goals of DBT are, I had such an aha moment as a longtime therapist of like, why have I never thought about this before? That that we're so much a part of the treatment delivery experience that we should be considered as part of this process, and that delivering it should be enhancing and motivating to the therapist too. And I'd never heard that in any other modality. To me, it was such an aha, like, of course we should be included, because we really are, we're a key half of the therapy relationship.
It's true. It's true. Okay, so one of the main tenets of DBT is this idea of the synthesis of opposites, and it shows up for us in the 3 states of mind. And I think a lot of programs that do DBT in a non-adherent way talk about this concept, but what I find most helpful is to actually teach this concept in the way that it's shown on the screen, because all of the skills, when we get into the modules, all of the skills I think kind of bring you back to how do you get into this wise mind place, which as DBT does, it's the synthesis of the opposite of the emotional mind and the rational mind. And I sort of present this in such a way where I say, listen, you're human. We all experience these 3 states of mind, right? It's not like one person is emotional all the time, one person is rational all the time, although sometimes it feels that way. We all exist on this spectrum of emotionality and then that realistic, rational kinds of places. And so with the client, I'll talk about, what does your emotional mind look like? You're ruled by your moods. Lots of people feel like it's chaotic. They feel overwhelmed with the way that they feel and the way that their body feels. And then this idea of, what's your rational mind look like? Well, I'm devoid of emotion. Sometimes people will say that they're numb. When this is adaptive, it's rational, focused on your tasks. But a lot of times people are like, yeah, sometimes I just swing from that place where I'm like, I'm not going to feel anything, and I am only going to deal in my reason mind. And then we talk about this idea, neither one of those completely by themselves in those extremes can be that helpful for your relationship. So instead, we want to use this idea of synthesis of opposites and bring ourselves to this place of wise mind, where you can utilize your emotions instead of being ruled by them, and you can utilize your rational mind instead of being numbed out from your emotions, and find those 2 things coming together with balance, making choices that include both of those, using common sense, being wise, as they say in Wise Mind. And I like to tell people, making decisions is wise in wise mind are the best decisions that you're going to make, because you're able to take in your emotions, which matter and are telling you something, and use that rationality, which matters and is telling you something, and bring those 2 opposites together to be the most adaptive that you can be.
And I will say that even just presenting this Venn diagram and having a conversation about it tends to work really well in individual settings and in group settings. It's something that when you present it this way to clients, it tends to really help to organize how to consider these different parts of decision making, thinking, and feeling. So this is kind of a great one to introduce somebody to the work you're going to do in therapy.
I also, and I could talk about this for hours, so I won't do that today because you might get bored, but there's so many cool things that you can do around that. There's like with, just art therapy, you can do color blending with your emotions and your reason. You can do the Venn diagram. I like to, I know we're talking about emerging adults, but with high school students, I like to say, all right, what classes require your emotional mind? Which classes require your rational mind? Or how can you tell if your teacher is an emotion mind versus rational mind, that kind of thing. So there's lots of ways to conceptualize this, and when you can do it that way, it really helps people connect with, oh, that's what that looks like. That's what that looks like. And really, I'm working on that, the integration of the 2.
And you can see even just from this pretty simple introduction to DBT that we're already engaging mindfulness skills, because you have to notice the process for yourself or for somebody else if you're focused externally. And as you start to focus more on your own experience of these 3 states of mind and notice this in others, this is actually a really great foundation for more skillful interpersonal processes to happen, where the person has a new set of tools for healthier, more effective relationship skills too. Okay, Jessica, let's meet the modules. We're gonna
meet the modules.
Brief these DBT modules.
You cut out. I did not hear what you just said, but I think it's let's go for it.
Let's do it.
Okay, so DBT has a pretty structured approach in terms of what falls under different categories. There's some overlap in particular with mindfulness, but really when we look at DBT, we're looking at 4 kind of categories: mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. And they kind of all affect each other and can kind of stand alone as well. Like I said, there's a little bit of overlap, but also if like you spent one session only talking about distress tolerance or one group only talking about distress tolerance, that would also make perfect sense. So what we're going to do here is we're going to walk through each of the modules and talk a little bit about what it looks like, and then how to help, I keep calling them students, how to help these emerging adults practice in between sessions. I'm sorry, I was a teacher before I was a therapist. Sometimes the student word just like flies out. I mean, next I'll be calling them kids. I'll be saying my kids in group. Sorry about it.
Okay, let's start with mindfulness. And I think that so we get feedback about this a lot. And I just want to say in advance, you're right, that mindfulness is not a concept that's unique to DBT. And actually, there are some parts of DBT that you can tell that they're part of the larger family of modern CBT intervention options, I'll call them, or fully realized theories. And I think that there are certain parts of DBT that are unique to the model, but there's parts of it that aren't, but they still really support and are necessary for the things that are more particular just to DBT. So mindfulness is part of DBT, just like it is for other cognitive behavioral-based therapies.
So the main differences between mindfulness and mindlessness is this idea of, I always just say it very simply, paying attention on purpose. So when you are practicing mindfulness, you're noticing thoughts without being overwhelmed by them. You have the ability to plan and consider before making decisions. And then also you're able to recognize when it's important to use skills. And as we go through, you'll notice there are some scenarios where you would use this skill versus that skill. But when you are practicing mindfulness, you're able to say, this is an opportunity for a distress tolerance skill versus an emotion regulation skill, and do so effectively. So it's really just being in the moment, paying attention on purpose, where the opposite is mindlessness, where it's really easy to become overwhelmed by your thoughts or your emotions. You act impulsively without thinking about what other options you might have or what other consequences might occur from those actions. And part of that is because you're so overwhelmed by your thoughts and your emotions, you end up in that fight or flight because your brain is not paying attention on purpose. And then you're also missing opportunities to use skills, or you use them ineffectively, or perhaps you end up in a space where you're using one of those maladaptive quote unquote skills because you are not paying attention on purpose, and you just kind of do it automatically because your brain knows that it's worked in the past for you.
Perfect.
So as Stacy mentioned, the idea of mindfulness is not it's not unique to DBT, and it's also not even unique to therapy, to be totally honest. I don't know how often you scroll TikTok. Everybody should stop. But there's a lot of talk about practicing mindfulness everywhere, right? And so the thing that I think is really interesting about DBT, and it's the most effective that I've ever seen this explained, and this is perhaps because this is how my brain works, but DBT has this concept of what and how. This is what you do, and this is how you do it. And I noticed that this is really helpful because when you're coming across people that are like, I'm bad at mindfulness, they're not bad at it. They just don't really understand what it means. They think they're just supposed to sit there. So what you do is you observe, focusing on one thing at a time. You describe what you notice in words. And one of the other tenets of DBT is this idea of being non-judgmental. So I always encourage people to do this in a non-judgmental way. You maybe are observing the way that your legs feel on the chair, and you're saying, I feel pressure, as opposed to, this is a really uncomfortable chair, kind of a thing. And then you participate. You're fully present in whatever it is that you're doing. Observe, describe, participate. That is what you do. and then how you do it, not judgmentally, observing without adding judgment. This is not good. This is not bad. It just is. Like my foot is putting more pressure on, my right foot is putting more pressure on the floor than my left foot. That actually has nothing to do with anything else. One mindfully, one thing at a time, and then effectively do what works. I think that this shows up quite a bit, for me, at least in my practice, when I'm doing mindfulness practice with my clients, because we talk about, let's say, the idea of meditation. When people think of meditation, I've always imagined, a monk sitting in lotus position with the but that is actually really not very comfortable for my body. So I sit in a chair and I put both my feet on the floor, and effectively that's what works for me. So when I'm doing this with clients, I'll say that I'll give that example and I'll say, I do it this way because this is what works for me. What do you think would work for you? What do you think is the most comfortable for you, so that you can do what you're doing, how you do it? So that's kind of the overarching idea of mindfulness: observe, describe, participate, and do so in a non-judgmental, one thing at a time, effective manner.
The nice thing about this too is that doing one thing at a time effectively has an almost unlimited amount of possibilities too. So if you're like me, so Jessica doesn't like to sit in lotus position. I don't like to sit still at all. And to me, that is actually very difficult. I find it really hard to tolerate. But I can do this much, much more effectively if I am walking. So that's also a totally fine way to do this. It's really more about finding something that's effective that you can do one mindfully and then doing it. Okay, let's take a look at some options for how we might help somebody to practice mindfulness when they're in between sessions with us.
So this is, if you're familiar with mindfulness, this might be one that's familiar to you. We refer to it as 5, 4, 3, 2, 1. And essentially you are taking just a few moments to be present, pay attention on purpose, and just notice 5 things you can see. So you're sitting in the room, you look around. Right now I can see a frame with my TED Talk stuff in it because my mom made me a shadow box. I can see a television on my wall. I can see my mouse that's in front of me. I can see my computer screen to my right, and I can see my favorite teal chair to my left. That's it. I'm just noticing. 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing that you can taste. And the reality is, if you don't feel like you're going to remember these in the exact right order, it doesn't matter which sense you're talking about. I will give you a pro tip. 1 thing you can taste is usually the easiest because most often you're not tasting more than 1 thing. Also, will you say that again?
5 things that you can taste would be difficult.
5 things that you can taste would, I might have some other questions if you were tasting 5 things. Another tip that I think is really helpful, in particular with the emerging adult population, this is a skill, right? Mindfulness is a skill. And when people say, I'm bad at mindfulness, one of my reactions is, well, you're probably not practicing, right? And you have to practice paying attention on purpose, because your whole life you've been not paying attention, not on purpose, right? And so something that's really helpful with emerging adults especially is I teach the skill of mindfulness. We do a mindful practice. We talk about this one. And then I go, okay, I want you to get out your phone. Let's pick 3 or 4 times over the next week where you're not going to be driving, because I don't want you to do 5, 4, 3, 2, 1 while you're driving. I'd rather you pay attention, be mindful when you're driving. You're not going to be driving. You're not going to be sleeping. And any other thing that might fit that person. Let's pick a couple of times, and we'll set reminders in their phone. And I go, when that reminder goes off, I want you to stop and just observe. 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. I might print them a little copy of something. We might take a screenshot of that so that they can remember. But I just want you to practice it. I just want you to notice how that feels, and then you can bring it back to session the next time and we can see how that went. And if this mindfulness doesn't work for you, we can try something different.
So Jess, I'm glad you just said that because we got a great question from the audience.
Ooh, I'm so bad at noticing the question.
I'll be in charge of the questions. Okay, so this question is from an anonymous participant. Otherwise, I would attribute it. But it says, I work with mandated clients. What advice do you have on getting buy-in? Many of my kids think mindfulness is goofy or uncomfortable and overwhelming to slow down their thoughts. And in parentheses, there's comfort in the chaos due to a history of trauma. And the next part of this is, would focusing on external observations, like observing or describing an object versus an internal experience or thoughts, be as effective?
So my first instinct, and I'm interested to know what you say, Stacey. My first instinct is, because you said kids, with kids, I've noticed that the external stuff is easier. And also with kids, one of the first ways that I teach mindfulness, or one of the first mindful practices that we do together, is mindful eating. You have to be careful about this with like the eating disorder community. But where I like to do, you know, those little Dove chocolates that have little sayings in them. I get a couple of different flavors of the Dove chocolates, and we do a mindful practice where we, you know, just notice it. What does it look like? What does it sound like? All of those things. With the two different, like a dark chocolate and a milk chocolate, or a dark chocolate and a caramel. And then we practice describing the comparison between the two without judging them. And when I was a teacher, most of the time kids are bought in if you feed them. That's always been my experience.
I think that concept would work with all ages in particular. But yeah, I do think that this is actually a really, sometimes even just the word mindfulness, people have kind of a response to, like, oh, this is a little bit new age for my tastes. So you can also just label it something different, like noticing or observing sometimes can be really helpful. And then I think that the question that they're really onto the right idea, which is that that our goal over time is to help somebody build up their distress tolerance skills and their mindfulness abilities so that it is easier to tolerate being mindful about one's own internal state. But that doesn't mean you have to start there. And you should feel free to use your clinical judgment to titrate this up and down in terms of how intensely they're going to focus on that and what the pace is for that specific person. So sometimes we have people who come in and they are really ready to sit with uncomfortable thoughts and feelings, like they're ready to do that work. And other times we might spend multiple sessions with people, helping them to just focus externally. So for instance, one thing we do in a group setting is we'll have people, so our older teenagers will sometimes create means of, like, kind of bottles full of water that they fill with material that will float at different paces. And that will simply have them practice observing as the debris settles in the bottle, like glitter or beads or things like that. And that's an external form of practicing mindfulness skills as well. So the goal is then to tie that over time into internal states.
That's one of my favorite ones to do with young adults too, because we forget how much they like the art project piece of it.
Yeah, there's something about making this tool yourself and then using it that helps bring this concept to life a little bit more concretely, I think. And Jessica and I own, I don't know, like 60 of these projects that our clients have made.
I actually started, I'm in my home office today, but I started looking around. I was like, do I have one here I could show? But I think they're all at the various offices.
Yeah, I think there's not a surface at Transitions that doesn't have one of these on them, but just in case someone needs a mindful moment, you never know. All right, let's shift over to, we're going to talk just briefly about emotional regulation, and we'll give you an idea about how to help somebody practice this as well. And I'm going to keep an eye on questions or comments, and I appreciated that one from our participant.
Absolutely. Yes. Thank you. I don't know. That's like the thing I'm worst at in presentations is paying. I just start talking and I'm like, all right, let's keep going. So please interrupt me. Emotional regulation is the next module in DBT. And the idea of emotional regulation is really just learning to understand your emotions, both in general and also your own information, your own emotions. And I think that that's an important distinction to make, because this is certainly true for adolescents. And I also think it's very, very true for emerging adults. And if I'm being honest, it's true for, I call them real adults. That's not a kind way to say that, but it's true for fully realized adults. That's what we'll go with.
I always describe them as mid-career and post-career adults.
Oh, that's a much kinder way to say it. But oftentimes our reactions or our behavior or our comments or whatever, they're actually based on our perception of somebody else's emotion. And sometimes that perception is accurate, certainly, but being able to understand emotions in general, the way we're feeling them and the way that other people are feeling them, that's a really big piece of emotion regulation, because it sort of helps to for you to not react to somebody else's emotional state. And then it also is working to develop the ability to act effectively in the presence of difficult or strong emotions. And again, that's for your own emotions, and then also your perception of other people's emotions.
This is what I love about DBT is I like how a lot of the skill building around emotion translates into action again in the real world. And I think that's why clients respond to this so positively too, is because there are really tangible things to do.
So I always think that the easiest way to understand emotion regulation is really to think about what emotional dysregulation is. And oftentimes when we see a person having really big emotions, we kind of go, oh, you're dysregulated. Like somebody is, crying very loudly, or more angry than you think that they should be. That kind of registers in our mind as emotional dysregulation. And sometimes it is, but really emotional dysregulation is when somebody's attempts to regulate their emotions in the short term at the cost of their long-term goals. So like, for example, sometimes if somebody is intensely angry, their reaction is to punch a wall or to yell at a person. And that is their attempt to take that physical feeling of anger and regulate that by having a physical action or an interaction. But really, that's at the cost of their long-term goals of maybe maintaining their physical safety in their home or maintaining that relationship. So really big emotions sometimes indicate emotional dysregulation, but that's not really what it's about. It's just about when you're attempting to regulate in the short term and it's costing you in the long term.
And this is such a rich talking point in therapy, because this comes up so often in people's work relationships, their friendships, and their dating relationships. And just like kind of a work example of how this might present is, let's say that Jessica's late for work, and which Jessica is very timely. So this is
I was like, I don't know that that's ever happened, but good example.
And let's say, so for me, I can admit as a person that people being late to things is one of my hot button issues. And yet I have a set of long-term goals for my relationship with Jessica, my working relationship. Like in 1 year's time, I still want to be productively working on the things that we're working on together and whatever we dream up in between now and then. And I want to respond to her lateness with my long-term goal for our relationship as my guide, not to resolve my own short-term irritation that she's late. And when you start thinking about things and helping clients to see their really important relationships that way, it becomes a lot easier to tolerate the presence of strong emotions and to act skillfully. And then I also can go into my wise mind and maybe have a measured conversation about timeliness that preserves my relationship with her long term.
And also causes me to be on time, because that is my long-term goal, is to be on time. I'm very good at being on time, for the record.
Yeah, I agree that 100%. Okay.
So practicing emotion regulation in session, in between session, I love this skill. In DBT, they refer to it as fact checking or check the facts. And I think that what is so cool about this is we've all in and out of therapy, been in a situation where somebody has been sitting in front of us and they're having an emotion and they're having some thoughts about things. And in our mind, we're like, what are you even upset about? Like, that kind of doesn't make sense to me. Or like, I fully understand where this other person is coming from and you're definitely overreacting, right? But we don't say those things in therapy. At least I hope not. But this check the facts gives us the ability to go, whoa, hold on a second. What is actually happening? What are you really having an emotion about? And really what you're asking is, what's the emotion I want to change when I'm trying to regulate? What prompted the emotion? What happened? Who is involved? But just the facts. I like to say as close to the universal truth as we can get. What happened? What is my interpretation, thought, assumptions? Practice looking at it from other people's point of view. Am I assuming that there's a threat here? Am I assuming that I need to protect myself? What's the disaster that's going to happen? And does my emotion or its intensity fit the actual facts? So essentially, this is what we're looking at. But when we're doing this in practice, that's a lot of questions, right? And so I like to look at this from a place of, this really comes down to 4 questions about the scenario. What happened? What did I make up? What was my thought about what happened? What's the story I told myself about what happened? Whatever version of that fits your vernacular. What is my emotion about that? And is my emotion about what happened or what I made up? That's what we're asking. And I always like to use a benign example with this. So I might say, if you told me you didn't like the color blue, and I got really upset because I was wearing blue that day, I might say, what actually happened is this person said, I don't like the color blue. Those are the words that came out of their mouth. I don't like the color blue. My thought about that was that they must not like me because I was wearing blue that day. And of course they wouldn't have said that if they weren't trying to tell me that they didn't like me, or why would they, don't they care about my feelings? And so I'm very upset. I'm very angry. I'm very anxious that they're going to reject me. But really my emotion is about what I thought about it. It's about my interpretation that they don't like me because they don't like the color blue and I'm wearing blue, and they wouldn't say that. Right? It really, do I really need to get upset or as intensely upset about the fact that they don't like the color blue, or that they said, I don't like the color blue? Probably not. That intensity probably does not fit, right? So what happened? What did I make up about what happened, or the story I told myself about what happened? How do I feel? And then, is my feeling about 1 or 2? Because it allows you to go, okay, do I need to practice some mindfulness or distress tolerance and diffuse my emotion? Or do I need to have a conversation about, about what my perception was and where my perception came from, and et cetera, so that that person can know me a little bit better? Maybe I can make a vulnerable request for them to not talk about colors in front of me, or not make comments about my outfit, whatever the case may be. So it allows you to kind of bring down that intensity, which is the point of regulating your emotions, so that you can behave in a way that protects your long-term goals, not at the cost of your short-term.
Thank you. And we had a couple of observations in the chat about this particular part of the DBT modules. People were observing the similarities with some other core techniques of the cognitive therapy canon, and they're 100% right. And really just the 4 questions is sort of a simpler way to kind of help a person come to this process of examining the difference between thoughts and feelings and their impact on their state of mind and their actions. This one actually works really well by telehealth too, in particular.
Mm-hmm. Well, and what is also interesting about this is, like I had said, the modules kind of overlap, and so, or there's points of connection is maybe a better way to say that. Like I had said on the previous slide, that's a lot of questions. That's a lot of things to think about. When you narrow it down to these 4 questions, you're kind of forcing yourself to be mindful about the situation. You're paying attention only to what happened, what you thought, and what you felt. And that's it. And so instead of having all of these extra things that are coming into it that don't have anything to do with the situation, you are mindfully saying, okay, what's going on and what do I need to do about it?
The other thing I really like about doing it this way is I'm sure we've all experienced working with clients who will just not do another worksheet. They just don't want to. And I understand, I do. We are people who love worksheets. But that's for people who that works for, that's a phenomenal fit. Some people really benefit from that tactile experience of filling in the worksheet. But for the people who that is not going to connect with them, this is actually a nice way to engage the same idea free from the worksheet.
Mm-hmm. And I think that's more true with emerging adults than many other populations.
Yes. Okay. Let's pause for a question from the chat. This is from Rachel, and she said, I have teens who seem to overregulate or shut down emotions more than struggling to regulate emotions in a highly dysregulated moment. So their intensity of emotions is a 0 on a scale of 10. When would it make sense for it to be, when it would make sense for it to be more like a 3? It starts to feel like there's nothing to work with. So somebody who's way over there in logic mind, rational mind.
Yeah. I'm not sure that I've ever had that question in this capacity. So let me process it for a hot second. I mean, I think for me, I think that the discussion around it would be, it's not exactly the same because it's not the same idea, but I'm still saying, okay, what happened? What did you make up about what happened that caused you to, like, what was the, I can't handle this, or I don't need to handle this, or this doesn't matter to me? And then how did you feel about it? I think that you could have that same conversation around that with regard to emotion regulation, but emotion regulation is not always about regulating the emotions that don't feel pleasant. It's really about being able to feel your emotions in a regulated way so that they can serve you, right? So that they can, all emotions serve a purpose. And they all, we experience, when we're in the emotion, we experience an action urge. And sometimes that action urge is appropriate. And when you are in a place where you're feeling it in a regulated way, that action urge will serve you to protect you or to help you make change or to help you make a connection. So I think that that's my answer to that question. Susie, what do you think about that?
I have 2 thoughts, which makes sense because it's a DBT presentation and they're pretty much opposite. My first thought would be, depending on the client, if I had a little bit more context, it might be helpful to, especially if this is a young adult or an older adolescent, to provide them with one of the very sophisticated feelings wheels, where we're simply going to help them to get more sophisticated at labeling and recognizing some of those shades of gray of feelings outside of those kind of core group of like angry, happy, sad. So part of this may be supported just by having some tools to language feeling. And then the other thing I might do is I would fall back to the Venn diagram we showed to begin with, the emotion mind, wise mind, rational mind. And I might instead engage them in a conversation, even hypothetically, about what do you think this situation might look like if you were seeing this totally from your emotion mind, to help them just connect the feeling to it. So I might use that as a way to help them imagine what would the situation look like in wise mind, rational mind, and emotional mind.
That was a really good question. I have experienced that before, but I've never conceptualized it with presentation words before.
That was a great question. Thank you.
Yeah.
Okay, let's move on to some interpersonal effectiveness. And we've got about 15 or 18 more minutes. So I think we should come right to the end, right on time, with space for some more questions too.
Beautiful. So interpersonal effectiveness is actually, with emerging adults, one of the most interesting pieces of DBT, because of the developmental stage that they're in, where they're kind of like separating from their family of origin and trying to find their way in the world. That inevitably comes alongside with relationships, and interpersonal effectiveness, when they don't have those skills, can be really difficult for them, in particular when they're trying to create new relationships, friend relationships, romantic relationships, and then also navigate the relationships that they have with their parents that are changing because their parents were in charge of them for 18 years and now they're still kind of in charge of them in some ways, but it ends up being complicated because the relationship looks different than it's ever looked before. So the purpose of interpersonal effectiveness is to develop skills so that you can navigate how those relationships exist and how those relationships might look different at this stage in your life than they've ever looked before. And that includes for asking for what you want or need from a relationship, a friend, romantic, parent, professor, therapist, whatever. Saying no effectively when you need to, and then also maintaining self-respect and respect for other people. That's the whole point of interpersonal effectiveness. There is a piece of my relationship with self and my relationship with others.
Awesome. And let's look at it. I will say that this part of DBT, I think, offers a lot of things you don't see in other modalities. And there are just an unbelievable amount of choices for how to include this particular module in the therapy setting. We've just chosen a couple for this purpose, but we could easily do a whole seminar just on interpersonal effectiveness interventions.
Absolutely. So the module itself, therapists love a good acronym. There's several acronyms that fit in here. But this particular one from DBT is called GIVE. And this is really about your relationships with other people. And so how you want to show up in that relationship with other people. And a lot of times, again, these modules kind of play on each other. A lot of times you're having to bring skills in to be able to do these things. You're having to be mindful when you're entering a relationship, or maybe tolerate distress or make decisions about how you're going to interact with somebody to preserve your long-term goal. But in general, when you are in a relationship with someone else, you give. The G is be gentle, kind of respectful, not judgy, using a soft tone of voice, listening. Sometimes you give them a compliment or an affirmation, no name calling, no yelling, hear what they have to say. The I is for act interested. And I think that's a really important piece of it. A lot of times somebody that you care about might be talking about something that you're not actually interested in. Like, I love my husband. He's a wonderful human. He loves Star Wars. I know that we have some people on the call that also love Star Wars. I could really care less about Star Wars, but I like him. And so I am not interested in Star Wars, but I'm interested in him, and I am interested in a thing that he likes, right? So you're actively listening, you're making eye contact, even though you don't really understand who Yoda is. I'm just kidding, I know who Yoda is. You're asking, intentional questions about how they're doing and what's going on with them. You are patient. Do not interrupt. This is a huge one that I think parents have to get better at as their kids get older. You're paying attention to your body language, and then you're sensitive to their opinions. The V is for validate. Understanding the other person's opinions, point of view, feelings, behaviors, etc. I really think this is something that people really struggle with pretty often, I think, because the idea of validation feels like it means I am validating that I agree with you, or I agree with your feelings, or I agree with your behavior. And so V for validate, in my mind, I'm just going to acknowledge your existence. I'm going to acknowledge that you have a feeling. I'm going to acknowledge that you have a perspective. Even if I don't agree with it, I don't have to, but it's okay for me to validate. I see that this is happening for you. Expressing an understanding without agreeing or approving, and then building trust and respect. And it helps when you can validate someone, when you can say, I see that you're having this feeling, or it's clear that you're struggling, or, I want you to know that I see you. It can really bring down those big emotions during conflict. And the final one is E, easy manner. Make a joke, although we have to be cautious with that. Also cautious with sarcasm, but really the whole idea is just about sometimes it's okay to be a little bit lighter hearted, and for you to let the little things go. sometimes allow yourself to connect by just making some small talk. Smiling goes a really long way. And then focusing on the positives of, what's going on, what the scenario is, or the person. And really, again, it's not about like laughing it off, shoving it under the rug. It's just about like, okay, maybe I don't have to take this so seriously, at least not in this moment, because again, my long-term goal is to engage in a relationship with this person.
I think the best thing about the give skill is how specific the actions are in the skill. So I think that this really, it moves having a good relationship from this kind of abstract place into small kind of bite-sized and doable actions that people can really take. And there's actually, what I like about give in particular is there are a lot of ways to safely practice this ahead of time. So the example I like is to suggest to somebody that the next time they're in a store, when they're working with a person who's helping them to check out, try the give skill with that person. So try smiling, try speaking in a softer tone of voice, maybe make a little bit of small talk and see how the other person responds back to you as a way of just testing this out in the real world in kind of a low risk way.
My favorite part about that challenge to clients, especially emerging adults, is that it means that they can't go through the self-checkout.
It's true. You do actually have to have another person to give to.
Yes.
It's very true. Okay. And we had a comment from Sonia who said, someone once told me that sarcasm is technically emotional abuse or being dismissive, so I try to be careful with that.
Yeah, same. Sarcasm is there are people that speak sarcasm. They're like fluent in it and they think that it's endearment, but it's not always taken that way. So you have to be really cautious.
Yeah, a joke has to be shared. Otherwise it's not a joke.
Right. Then you're just laughing at me.
Yes. And that's not going to be good for your long-term relationship skill. All right, let's do some distress tolerance.
All right, so distress tolerance is the final module of DBT, and it encompasses a couple of things, but the intention is to learn and recognize and then accept the presence of painful emotions and thoughts without those ineffective efforts to change or avoid them. So there are some things in life that we just have to feel our way through. I think that when we're talking about emotion regulation, part of that is reducing the intensity of that. And that's what regulation kind of looks like. But distress tolerance is really just about, I'm having this feeling makes sense. It fits for me to feel it. And I just have to practice feeling my way through it. Stacey, do we think we have time for me to switch to my whiteboard and draw my thing, or should I just explain it?
I think you explain it. That's okay. We've got about 10 minutes.
Okay, beautiful. So the 5-part model of distress tolerance, and I will draw this on a piece of paper or I'll draw it on the whiteboard so that we can kind of go back and forth. But essentially the purpose of this is to survive the crisis without making it worse. And so we talk about, we get triggered into an emotion and then we have an experience of emotion. And I tell people that we experience emotions in 4 ways. Physically, like how we feel it. In our mind, what do we think about it? In our behavior, what do we do when it's happening? And then what did I name the feeling? I call it my words, because for, somebody might say anxiety, where somebody else having a similar feeling is saying overwhelmed. And so I look at this and I say, okay, let's imagine that we're talking about anxiety, and we talk through, how do I feel in my body? Well, my heart races, I have a hard time breathing, I sweat, like I get sweaty palms, whatever the physical sensations are. And I go, okay, so when you're having anxiety and this is happening to your body, what is happening in your mind? Well, I'm having these thoughts. I can't handle this. This is not going to stop. I have to get out of here. When we're talking about anxiety, it's usually some version of like, I'm not safe. And I go, okay, what are your behaviors? You're having the feeling, this is what's happening in your body. This is what's happening in your mind. what are you actually doing? What are the behaviors? Well, maybe I pace. Some people will self-harm in this kind of a state. Some people will use substances, that kind of a thing. And then we have this opportunity to say, okay, this is the emotion. This is how you're feeling it. This is what you're thinking about. This is your behavior. And what's important to notice is that they all affect each other, right? When you're feeling anxious and your body is doing what your body's doing, it makes your thoughts more intense or worse. And then it makes your behavior more intense or more dangerous. And then you get more anxious and then your body gets more intense. And it just like cycles and cycles and cycles. And when you're talking, especially with anxiety, when you're talking to somebody, you can really say like, do you recognize this feeling? And they're like, oh my God, yes, I do. So the intention of this 5-part model in distress tolerance is to notice that you only have to intervene in one place and it slows the rest of it down. And I always think it's important for people to notice that what happened bubble, that's actually like out of the way, because it kind of doesn't matter what the thing is that triggered you, because you don't have control over that and it's already happened. And so what we can do is we can create a plan to intervene in these different places so that we slow the cycle down. It doesn't mean that the anxiety goes away. It doesn't mean that you don't, continue to have the feeling. It just means that the intensity can reduce and it doesn't feel quite as painful, so that you have the ability to kind of ride that wave of emotion and come down from the emotion without doing something that makes it worse or, affects your long-term goals.
All right. And before we move to the next slide, a question from the audience is there a DBT journal that guides this that people can use when they are dysregulated or triggered? And we're actually going to include some suggestions on that on our last slides. All right.
So radical acceptance is an extra little bonus. It's actually a part of distress tolerance. And this is one that many humans have trouble with, because it is the idea of there is a thing that's happening. There is this painful experience. And not only do I have to tolerate it, I have to accept that I can't change it. And so when we're talking about radical acceptance, when I'm talking to all clients, but in particular, emerging adult clients, I talk about this idea of there is a difference in pain and suffering. Pain is inevitable. It doesn't, like, you will not live a life without pain. You lose people, there's disappointment, you try really hard for something and it doesn't happen, relationships end, like we cannot avoid pain. But suffering exists when we experience that pain and we don't accept fully the thing that's happening so that we can move past it. And I always think of this metaphor of it's like you are in a burning basement, and that basement for some reason has a ladder as opposed to a staircase. If you just sit in the burning basement and you inhale the smoke and do all those things and it's hot and you feel like I can't get out, I'm never going to get out, I'm going to die, that is suffering. If you accept that the ladder is the way out, but you might burn your hands because it's a metal ladder, you can get out of the pain, experience it, tolerate it on your way out, but you don't have to suffer. That's kind of how I look at radical acceptance, but it's a piece of distress tolerance. And sometimes it's really difficult for emerging adults because there's this idea of like, well, this isn't fair. It's not fair is essentially it's not fair that I have to do this, or that I had to get this professor, or that my parents cut me off, or like, it's not fair. And sometimes you have to accept it, tolerate the distress that comes along with it, and ride the wave. And you know what? In a month, in 2 months, in a year, in 5 years, when you're 40, this won't be a thing anymore.
Right. We also had some comments from the chat, people observing how this part of the model shares some overlap with acceptance and commitment therapy. And that's totally true. And we didn't put it in this slide deck, but we actually have this really nice slide that kind of shows the umbrella of modern cognitive behavioral therapies. And under that kind of central umbrella would sit DBT, acceptance and commitment therapy, the kind of traditional like Aaron and Judith Beck CBT version. So they are definitely neighbors under this umbrella of CBT for sure. And I also see that our group is also doing a little bit of sharing of some resources that they have in the chat. And if you have a great DBT resource, feel free to include it in there. And I think somebody actually shared some Spanish language resources too, which is excellent. Okay. All right, so somebody asked for a workbook, and we love this. This is the original Marsha Linehan DBT skills training, handouts and worksheet. It's meant to be reproducible. And I know that not everybody loves worksheets, but when we work with young adults in our IOP groups, everybody actually gets this workbook on their first day. And it is amazing to watch clients work with this particular tool in between sessions. It's actually, like, we actually buy this with our own money and give it to clients. That's how much we believe in it supporting their care. And it's just incredible how people really find interesting ways to process and apply this material when they have a comprehensive workbook to help support it in between sessions. We try not to recommend books that we don't think are worth the price of admission, but this one definitely is. The nice thing about this book too is that actually you can buy with it an accompanying professional guide that is just meant for a professional audience. So it includes a little bit more depth and detail about each part that's presented to the client. That way you can seamlessly integrate it into the in-office experience with you, or virtual office experience, whatever the case may be, so that you have a lot of detail. It's kind of like the teacher's manual that goes behind this client-facing guide. And then because we're talking about emerging adults, we felt remiss in not including an app. So this is an app that's not specific to DBT, but it is specific to distress tolerance, and we just really love this one. So it's for free. It's called the Virtual Hope Box, and this is actually the high-tech version of an intervention I can remember doing in the early 2000s with an actual shoebox, before apps were a thing, where the person is going to fill up the app or the shoebox with things that remind them of the sources of hope in their life. And you can actually move pictures from your phone into it. You can move songs from your song library. It has like quotes you can add. It also has sources of distraction in case somebody needs that to help tolerate strong emotion when it appears. And it's totally free. We've seen people from teenagers all the way through post-career adults interact with this really effectively. It's a way to remind yourself that there are good things in this earth too, even in periods of distress. And then we included a podcast here for those who are interested. This is actually a podcast that's led by two therapists. It is not meant specifically for a professional audience. So they actually have lots of people on there, both therapists and clients, who pretty fearlessly talk about their experience of doing DBT and the challenges and the highlights of it. And these guys just do a really great job about bringing the people into this modality, kind of outside of this very technical material about how you present it and why, to really hear the lived experience of what it's like to receive this, participate in it, and also to deliver it. And then finally, so there are just a huge amount of options for additional training in this if you're so inclined. One that we like is the PESI 3-day DBT training. There's also lots of subtopic training in DBT you can do through PESI and other organizations, like lots of subspecialties focusing on this with different age groups, with different specific clinical focuses, and they tend to be really nicely done. Our crew has done almost all of them at one point in time or another. So you kind of can't go wrong with any of the ones that are available right now there. All right, and this is us, and we actually finished these slides last week, which was one day before our Goodyear office opened. So it says coming soon, but it's now here. You know, Jessica and I we're at transitions all the time. We want to be found. by all means, find us on our Facebook page or LinkedIn. We also work in and around the Phoenix metropolitan area. We love teaching and training in general. We especially love teaching and training future clinicians. So if you know anybody who's looking for an internship, we are always interested in helping to support somebody in becoming an independent clinician. And I know that in Arizona, we have a real lack of trained behavioral health providers. And I know that that's not just unique to us here in Arizona. So we love teaching and training if you know somebody who's looking. And I also just want to say that we really appreciate the chance to talk about DBT today, especially for young adults who have had a pretty challenging experience during the COVID last couple of years. Just an incredibly unique impact on this group of people who were expecting to have maybe a traditional college experience and then just didn't. So we really appreciate everybody who's also supporting them along with us. And I want to pause to make sure I leave some space for any questions that we can answer from the audience.
A great presentation, ladies. That was amazing. Thank you, Jessica and Stacy. I have a couple of questions that weren't addressed. One of them was DBT tools, and someone was asking, as well as myself, I was asking too, I'm curious about the feelings wheel. Can you talk a little bit about that and where to access a feelings wheel?
Yeah, so if you'd like, we can actually email the two we like to you or to Debbie to share. So there's one I really love, it's called the Stanford Ladders scale. And the other one I can email you because I don't think it has a name besides feelings wheel, but what it is it's a tool that's meant to be used in a professional setting that presents for a client a very nuanced visual representation of feelings. And they really reach pretty sophisticated language around. So for instance, it helps someone move from describing their feeling as angry into something much more actionable, like being able to identify it as feeling betrayed. So it will support them in recognizing that anger is there, but it actually needs more refining than that to really identify what is happening from an emotional perspective. So that's what it does. It takes you from the kind of like the easy to identify big feeling state down into the specifics in a visual way that a lot of clients, you might not think to work with adult clients with this, but it is fascinating what a helpful support this is for somebody who's in therapy, maybe for the first time in particular.
Great answer. Someone else was asking about DBT chain analysis, and I don't know if that is too complicated to get into now, or if you have some words about chain analysis.
I think that the explanation of it, complicated is not the right word, but it can take some time. But I mean, it's a DBT tool, and the essential function of it is to be able to identify places where you need to use skills. So like you look at an event that happened or an emotion that you had or an argument or a conflict or whatever, and you kind of like go through the chain so that you can identify, okay, here's what was happening. I could have used this skill, or next time I'd like to use this skill to regulate my emotion. This is where I should use a distress tolerance skill. This is where my interpersonal effectiveness could have been different, kind of a thing. Or at least that's how I've always used it. Stacy, do you use it differently?
No, I think that's the same idea, is really just mindfully reviewing opportunities to be skillful. And really has to be done with, like all things we do in the therapy chair, with empathy, because it's not meant to make anybody feel bad. It's really just meant to help increase mindfulness for opportunities to act more skillfully.
Mm-hmm.
More questions?
I feel bad I don't have that feelings wheel right now. People really want to see that.
That's so cool.
Okay.
Actually,
we're getting lots of comments on the feelings wheel, so we'll look forward to getting that.
This is kind of funny, but in our clinics, we actually have turned the feelings wheel into a really large piece of modern art. So we get them printed on these really large canvases and we hang them in the group room because it's like functional art, because they look really beautiful and they're really colorful. But we also use them almost every single group as part of the conversation.
That's awesome. I appreciated what you had to say about using DBT when things are going well and not just when there's the presence of something that is distressing or, that we want to make better, but just to make, positive improvements. That's a great way to look at things. It's pertinent to all of us.
It makes, when you practice it, when things are going well, it makes it easier to access them, those skills, when things are not going well. I always use the metaphor of, with young adults, this would work too, but I'll say to like a teenager, I'll say, okay, imagine that you are shooting the winning free throw in the state championship basketball game. Do you want to be in that position if you've never shot a free throw before? Or would you rather have shot like 100 free throws in a game previously, or in practice, or in your driveway, or all of those things, because the muscle memory will be there for you to shoot that free throw in a high stress situation like that. The same is true for coping skills.
Now's the time to ask these wonderful professionals some questions. You are experts. Well, Debbie, are you there? I'd like to thank Jessica and Stacy for this great presentation. It's such useful information for all of us. And I know as a parent and a therapist, I'm going to use it with my kids and my clients and and myself. Really appreciated it. I know we have a couple of announcements before we close off. I'm going to pass it back to Debbie with Aurora. Thank you again, ladies. That was really wonderful.
Thank you.
I'm happy to do it.
It's our pleasure.
Thank you so much. I screenshotted so many different things to my daughter who has like really severe anxiety and panic attacks. I was like, try this, try that, try that. So I love it. Thank you. Anyone who does want a copy of the PDF, email me. Quite a few people emailed me already. So I sent one group of those out. I'm happy to do that. CEU certificates will be completed. If you will please give us a week before you email me, I really appreciate it. We have to do them all individually and then email them out, so it takes a little bit of time. If you do not receive one by the end of business next Friday, then please feel free to email me. Once in a while, one does get missed or an email gets typed wrong, something like that. The next CEU presentation that Aurora is hosting is March 9th. And it's called What Is It Really? Trauma, Anxiety, or OCD? So it should be another interesting one. We have actually simplified the process. I'm praying that simplified is the right word. And we won't have the double Eventbrite and then where you have to register with Zoom. It will only be with Zoom. So if we have your email on file from any previous webinar, the email will go out to you, and we're really hopeful that that will help a lot of people. I know it gets super confusing with both of the logons. We had to do it in the past because we asked that question if you need a CEU or not. And we've realized that with Zoom, they changed something. We can ask the question now only with Zoom. So super happy about that. Transitions is awesome and amazing. I recommend them all the time. They have so many different locations. So I encourage you, if you have clients out there, or if you know of somebody who's looking for assistance, please give them a call. Absolutely love them, love what they do. I visited a couple of their offices. They're warm and inviting and calming and peaceful, which is important to me. So I would like to thank Jessica and Stacy again. Thank you, Rachel, so much for being the moderator, so that I could, be tackling email things and problems behind the scenes. We appreciate all of you, and I hope everyone has an amazing weekend. I did put a little QR code up. If you have a second to post a review, we always appreciate that. And I usually try to send that with the CEUs too, if you didn't get a chance to do that today. So, all right. Well, I hope everyone has a terrific weekend, and we'll see you all next time.
Bye, everyone.
Have a fine mental health day.
Oh, I love that.
Bye.
Thank you.